All India Radio presents Morning News. Good morning. I am Sarabjit Kaur and with me is Vaibhav Jyotsna Srivastav. The headlines. Prime Minister Narendra Modi calls for converting COVID-19 crisis into an opportunity to make India self-reliant. Recovery rate of COVID-19 patients improves to 49.21%. Railways fully geared to provide modified coaches for use as COVID care centres. Third phase of Vande Bharat mission to have 432 international flights from 43 countries. Punjab government orders lockdown on weekends and public holidays. And India asks UK not to consider fugitive businessman Vijay Mallya's request for asylum. Prime Minister Narendra Modi said the country has moved from the policy of command and control to plug and play in order to prepare it for the post-COVID world. Addressing the industry heads at the 95th annual plenary session of Indian Chamber of Commerce on the theme of People, Planet and Profit in Kolkata through video conference yesterday, Prime Minister highlighted government's people-centric, people-driven and planet-friendly policies. He said it is the time for bold investments and bold decisions to build a globally competitive, strong domestic supply chain in the country. The Prime Minister said the country is fighting multiple challenges on many fronts. He affirmed that these odds have further strengthened the determination of the country. Highlighting the importance of Atmanirbhar Bharat, he said the country is determined to convert the challenges into an opportunity and termed self-reliance as the key solution to pave path for the post-COVID world.
कोरोना का संकट पूरी दुनिया में बना हुआ है। पूरी दुनिया इससे लड़ रही है। कोरोना वॉरियर्स के साथ हमारा देश इस लड़ाई में जरा भी पीछे नहीं है। लेकिन इन सब के बीच हर देशवासी अब इस संकल्प से भी भरा हुआ है कि इस आपदा को अवसर में परिवर्तित करना है। इससे हमें देश का बहुत बड़ा टर्निंग पॉइंट भी बना रहा है। ये टर्निंग पॉइंट क्या है? Atmanirbhar Bharat.
Prime Minister said self-reliance has been paramount in government's policy decisions in the last 6 years and maintained that the COVID crisis has given an opportunity to speed up efforts in this direction. Remembering Swami Vivekananda's mantra for Indians to use their own produce and find markets in other countries, he termed self-reliance as the key solution for India. He said that Swami Vivekananda has shown the path for a post-COVID world. Emphasizing on the need to cut down imports, he said production of goods in the country has been encouraged by the various reforms announced by the government and reiterated his call to go vocal for local.
आत्मनिर्भर भारत अभियान का सीधा सा मतलब है कि भारत दूसरे देशों पर अपनी निर्भरता कम से कम करे। हर वो चीज जिसे इंपोर्ट करने के लिए देश मजबूर है वो भारत में ही कैसे बने। भविष्य में उन्हीं प्रोडक्ट्स का भारत एक्सपोर्टर कैसे बने, इस दिशा में हमें और तेजी से काम करना है।
The Indian Council of Medical Research has asserted that India is not in community transmission of COVID-19. Briefing media in New Delhi, Director General of ICMR, Dr. Balaram Bhargava said that the country has to continue with effective surveillance and containment strategies. He said, India is such a large country and prevalence is very low.
India is such a large country and the prevalence is so low. We have found that the prevalence is less than 1% in these small districts. In the urban areas it may be slightly higher. In the containment areas it may be slightly higher. But we are definitely, India is not in community transmission, and I would like to emphasize it is not in community transmission.
Dr. Bhargava informed that India's COVID-19 cases per lakh population is the lowest in the world and the number of deaths per lakh population is also amongst the lowest in the world. The recovery rate of COVID-19 patients has improved to 49.21%. The Health Ministry representative said the number of patients recovered presently exceeds the number of active COVID patients. On this occasion, the results of ICMR's population-based Sero survey was released, which says that 0.73% of population in 83 districts where it was conducted had evidence of past exposure to coronavirus infection. It said the lockdown and containment have been successful in keeping it low and preventing rapid spread. As per the survey, however, a large proportion of the population is still susceptible. The survey was conducted for COVID-19 in May this year. Maharashtra, especially Mumbai, is battling hard to contain the COVID-19 pandemic as the number of COVID-19 patients continue to rise. Meanwhile, the recovery rate in the state is improving, but the metropolis is always facing different crises along with security issues. Therefore, the economic capital of the country is upgrading itself with the help of technology and getting ready to face the crisis in future. More from our correspondent.
Considering the hardship faced by the COVID-19 patients in the allotment of beds in the hospitals, the Bruhan Mumbai Municipal Corporation BMC has established a decentralized hospital bed management system and made it operational in all the 24 wards. Earlier, the patient used to get the information with a single helpline number about the availability of the beds, but with the new facility, they can avail the information from each ward, which will be faster and easier. Another facility was placed in the service of the metropolis, which will be useful to monitor the promenades in Mumbai. Maharashtra Home Minister Anil Deshmukh inaugurated Segway electric scooters for police personnel at Marine Drive in South Mumbai, while 50 of these two-wheeled self-balancing personal transporters will be deployed in South Mumbai. They will be also introduced for cops in suburban Bandra, Juhu and Warsaw areas. The police personnel manning Segways will have public address system attached to their masks, and they will also monitor social distancing. A state-of-art integrated flood warning system for Mumbai will be jointly launched by Union Minister for Earth Sciences Dr. Harshvardhan and Maharashtra Chief Minister Uddhav Thackeray today. In a bid to prevent or at least mitigate flooding in the megapolis, the Municipal Corporation of Greater Mumbai had approached the Ministry of Earth Sciences to develop the warning system. Shailesh Patil, AIR News, Mumbai.
The number of coronavirus cases in Gujarat crossed 22,000 mark yesterday with the addition of 513 fresh cases in the last 24 hours. A health department release said 366 patients were discharged from hospitals in the last 24 hours, taking the number of recoveries to 15,109 in the state. The death toll in the state continued to rise even yesterday. With the death of 38 more patients in the last 24 hours, the death toll in the state increased to 1,385. As many as 5,573 patients are undergoing treatment for COVID-19 across the state. Our correspondent reports that the state government yesterday allowed testing by private laboratories based on the prescription of any private physician who is an MD. The decision will come into force from today. Let's hear a report on this.
State Health Minister Nitin Patel told media that private laboratories can test the samples for COVID-19 based on the prescription from any MD or above-level doctor. The doctor should inform the health department through email about such cases. Mr. Patel said strong action will be taken against the hospital in case of overcharging. He said citizens can approach directly to his office to register a complaint in this regard. Earlier, only hospitalized patients were allowed to undergo testing from private laboratories. Talking about the continuous surge in the death toll, Mr. Patel said the majority of the deaths reported in the state are due to comorbidity. The Ahmedabad district reported a total of 1,117 deaths till date. The district recorded more than 7% mortality rate, which is one of the highest in the country. Meanwhile, Gandhinagar district administration issued a notice to a private hospital in Dehgaam town after it was found to be treating COVID-19 patients without necessary permission from the authorities. Aparna Khun, AIR News, Ahmedabad.
In our series Experts Speak, we bring you the views of the leading medical experts on COVID-19. Dr. Anant Mohan, head of pulmonary medicine AIIMS, has advised people not to take medicine like hydroxychloroquine or anti-malarial without a prescription by a doctor.
Please do not take medicines such as azithromycin, other antibiotics, antivirals or hydroxychloroquine or other antimalarials without a proper prescription by a doctor. Do not self-medicate.
Ms. Jacinta Gunjial, Senior Nursing Officer AIIMS, has stressed on the need for social distancing.
Social distancing is a non-pharmaceutical infection prevention and control intervention to break the chain of infection.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle @AIR News Alerts by hashtag AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:30 p.m. onwards.
Indian Railways is fully geared to provide COVID care centres to state authorities. Trains with unit composition of 10 coaches with patient capacity of 16 per coach have been made ready. Railway Ministry said a total of 5,231 coaches were modified to be used as COVID care centre. Telangana has asked for coaches to be stationed in 3 locations, Secunderabad, Kachiguda and Adilabad. Uttar Pradesh has finalized 24 stations for deployment. In Delhi, 10 coaches are stationed at Shakur Basti location. The ministry said zonal railways have converted these coaches for quarantine facility. The coaches can be used for very mild cases that can be clinically assigned to the COVID care centres as per guidelines issued by Health and Family Welfare Ministry.
External Affairs Ministry spokesman Anurag Shrivastava has said the Phase 3 of Vande Bharat mission will last till the 2nd of July. The third phase started yesterday. Briefing media, he said the Phase 3 will have 432 international flights from 43 countries, reaching 17 states and union territories. In this phase, there will also be 29 flights from private carriers, 24 Indigo flights, 3 Go Air flights and 2 Vistara flights. The number of flights from the US and Canada have also been increased given the huge demand. There are 53 flights from US and 24 from Canada. There will be 16 flights from Paris and 16 from Frankfurt, which are to be used as hubs in Europe. Mr. Shrivastava said this phase of Vande Bharat mission has widened the reach by including more countries and increasing the number of entry points.
Over 170,000 citizens have returned to India through different modes of transport in one of the world's largest evacuation drives. In a tweet, Civil Aviation Minister Hardeep Singh Puri said, nearly 75,000 citizens have returned through Vande Bharat mission flights, while around 21,000 through chartered flights. Over 61,000 people have returned through land border crossings. Mr. Puri said the government continues to bring back stranded and distressed Indian citizens from all over the world.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi calls for converting COVID-19 crisis into an opportunity to make India self-reliant. Recovery rate of COVID-19 patients improves to 49.21%. Railway is fully geared to provide modified coaches for use as COVID care centres. Third phase of Vande Bharat mission to have 432 international flights from 43 countries. Punjab government orders lockdown on weekends and public holidays. And India asks UK not to consider fugitive businessman Vijay Mallya's request for asylum. For quick news updates around the clock, follow us on our Twitter handle @AIR News Alerts.
अपने साथ अपनों का ध्यान रखो, बड़े बुजुर्गों का तुम ध्यान रखो, तो बात करो, कुछ मदद करो, कोरोना के चलते याद रखो, घर से निकलो तो मास्क पहनना, मास्क के पीछे मुस्कुराना, सुरक्षित दादा दादी नाना नानी अभियान, अपने साथ अपनों का ध्यान.
Punjab Chief Minister Captain Amrinder Singh has ordered lockdown on the weekends and public holidays with movement to be restricted to e-passes holders. All citizens except medical staff and essential service providers will be required to download e-passes from the COVA app. Chief Minister issued these directions at a video conference meeting to review the pandemic situation and the state's preparedness to handle further spread. Industry, however, will be allowed to function normally on all days. Chief Minister has asked DGP Dinkar Gupta to ensure strict implementation of these directives to prevent gathering of large crowds. Chief Minister also asked medical and health experts to consider imposition of strict conditions, including mandatory testing certification for entrants from Delhi, where corona cases are rising sharply. On an average, 500 to 800 vehicles come to Punjab from the national capital every day. A total of 1,877 new confirmed cases of coronavirus have been reported in Delhi during the past 24 hours, taking the total number of cases to 34,687. Delhi government has confirmed that 12,731 people affected with coronavirus have been cured so far. In the last 24 hours, 486 people recovered and 65 deaths were reported in the national capital, taking the toll to 1,085. The recovery rate of the COVID-19 patients has improved to more than 74% in Rajasthan. 8,775 out of a total 11,838 COVID patients have recovered so far in the state. The number of active patients of COVID-19 in the state now stands at 2,798. Meanwhile, 265 persons died due to corona infection. More from our correspondent.
6 districts are having more than 100 active patients, which includes Jaipur, Jodhpur, Bharatpur, Pali, Alwar and Sikar. There are 14 districts which have more than 50 active patients. In 6 districts, the number of active patients of COVID-19 is less than 10. Curfew has been imposed in more than 70 villages of Bharatpur district after corona outbreak. Meanwhile, the state government's task force has recommended a package of 700 crore rupees to bring back the industries on track after that are affected due to the lockdown. Apart from this, it has also been proposed to waive off the permanent charge of electricity bills of lockdown period of industries along with cheap loans and higher subsidy. In this report, it has also been proposed to give 1,500 rupees for 3 months to the people associated with the tourism industry. Jitendra Dwivedi, AIR News, Jaipur.
Uttar Pradesh government is launching state-level sample collection campaign today to find out the level of corona infection among the different sections of society. The campaign will run for 1 week, in which various clusters of the society will be tested, which includes delivery boys, newspaper vendors and other daily workers. Principal Secretary Health Amit Mohan Prasad said that under this campaign, samples of those people will be taken who move frequently due to their work. More from our correspondent.
Today, on the first day of campaign, team of health workers will visit old age homes, women's hostels, orphanage and juvenile homes and will take samples of the inmates. Tomorrow on Saturday, samples will be taken from slums of the city areas. Similarly, those people who are involved in home delivery, newspaper vendors, employees of hospitals, milk suppliers, security guards, pharmacists, salesmen and clerical staff of hospitals will be tested on different days. The aim of this exercise is to get the information about the spread of the corona infection so that measures can be taken to control this. Amit Mohan Prasad said that such kind of campaign was launched among migrant workers in 18 districts of the state to know the level of infection. In these districts, 72 villages were chosen where 50 or more migrants had returned, and after completion of their 15 days of quarantine, other persons of the villages were tested to get the information about spread of the virus. He said that all reports of tested persons came negative. Sushil Chandra Tiwari, AIR News, Lucknow.
Bihar recorded its highest single-day count of COVID-19 so far, with 250 new positive cases during the past 24 hours. The total number of cases now stands at 5,958. The death toll due to corona is 34. The number of recovered patients are 3,086 and 2,862 are undergoing treatment in various hospitals of the state government. There are 325 containment zones in different districts of the state and strict surveillance is being done. In Madhya Pradesh, Divyang Anganwadi workers are playing an important role in the state during the ongoing corona crisis. They're distributing nutritious food from house to house of the beneficiaries. They're also advising people to avoid corona infection. A report.
The villagers say that if the Divyang are working in a time of crisis, we too can protect ourselves by adopting their advice. Kanchan Gairi, an Anganwadi worker of Prempuriya village in Mandsaur district, is also a Divyang. She advises that stay at home and follow the mantra of social distancing.
जब से कोरोना महामारी आई और लॉकडाउन लगा तब से लोगों को समझाइश दे रही हूँ और लोगों को जागरूक कर रही हूँ। घर घर जाकर हितग्राहियों को पोषण आहार वितरित किया। घर घर जाकर बच्चों व गर्भवती धात्री महिलाओं को सत्तू वितरित किया। बाहर से आए हुए लोगों की जांच कराई एवं उन्हें आयुष विभाग की गोली वितरित की।
While another Divyang Anganwadi worker, Sarvo Shukla of Madhi village of Rewa district, is advising the villagers to wash their hands regularly. Similarly, paralyzed retired bank worker Babulal Rathore of Shajapur has given 50,000 rupees out of his pension amount to the Chief Minister's Relief Fund. The Madhya Pradesh government has given status of Corona warriors to the Anganwadi workers. Sanjeev Sharma, AIR News, Bhopal.
Telangana reported 209 fresh COVID-19 cases and 9 deaths yesterday. With this, the total reported COVID-19 cases in the state has gone up to 4,320. Among the fresh cases, Hyderabad reported majority cases of 175. Medchal district, where COVID-19 prevalence is high, also reported 10 new positive cases, while remaining 23 cases have been reported from 10 different districts across the state. Karnataka reported 204 new cases of COVID-19 and 3 deaths yesterday, taking the total number of infections to 6,245 and the toll to 72. Out of the new cases reported yesterday, 157 are returnees from other states, mostly from Maharashtra. Medical Education Minister in Karnataka, Dr. K. Sudhakar, has informed that 800 teams will be formed under Bruhat Bengaluru Mahanagara Palike to conduct door-to-door survey to identify people vulnerable to coronavirus infection.
In Tamil Nadu, 1,372 COVID-19 patients returned home from hospitals yesterday after recovery from COVID-19 disease. However, 1,875 others were confirmed positive yesterday, leading to the total infection climbing to 38,716. Tamil Nadu Chief Minister Edappadi Palanisamy has said there is no community spread of COVID-19 in the state yet. More from our correspondent.
In Chennai, the city civic body has mandated that all those who approach a laboratory for COVID-19 testing will be quarantined for 14 days. Their family members would also be quarantined for an equal period. In the city, there are 30 recognized laboratories to test their samples, including 12 government facilities. To trace the people seeking the test and their close contacts, the particulars are to be collected by the laboratories and be uploaded in a dedicated mobile app that can be accessed by the health staff of the city corporation. Its Commissioner Prakash has said in a statement, about 6,000 field staff would be deployed for rendering help to those who are under quarantine, like supplying essential things. His announcement comes in the wake of reports that some of those under quarantine violated the safety protocols and stepped out of their homes. Jai Singh, AIR News, Chennai.
Amid increasing COVID cases, Kerala government has decided not to allow devotees in the Sabrimala Ayyappa temple for now. It was also decided to defer the 10-day annual festival and to conduct it as mere ritual. Earlier, it was decided to open the temple through online reservation. Authorities informed that Sabrimala, being a large pilgrim centre where people from different parts of South India congregate in large numbers, the risk involved in throwing the holy hillock open for devotees at this situation is very high. In Nagaland, the number of COVID-19 cases has gone up to 147, with 17 new cases reported yesterday. The active positive cases in the state stands at 117, while 30 positive patients have recovered from the disease. In Tripura, 49 new COVID-19 positive cases have been reported during the last 48 hours, taking the toll to 916, with 638 active cases. 278 corona patients have been discharged from hospitals after recovery.
Indian Space Research Organisation ISRO will organize online ISRO Cyberspace Competitions 2020 to ignite young minds in the country. The ICC 2020 online competition will involve drawing competition for class 1st to 3rd students, model making competition for class 4th to 8th, and essay competition for class 9th and 10th students. For the students of class 11th and 12th, essay competition is organized with space quiz contests in Hindi and English. Registration and other details for students are available on ISRO website www.isro.gov.in/ICC2020. India has asked UK not to consider fugitive businessman Vijay Mallya's request for asylum in that country. External Affairs Ministry spokesperson Anurag Srivastava said that New Delhi is in touch with the UK for his early extradition. India argued that there are no grounds for the fugitive businessman to be persecuted back home as alleged by him in his plea. The development comes after a spokesperson of the British High Commission said that legal issue remains to be resolved before the fugitive economic offender could be extradited to India. Last month, Mallya lost his appeals in the UK Supreme Court against his extradition to India, where he stands to face money laundering and fraud charges. The UK Supreme Court's verdict, which came within weeks after he lost an appeal in the High Court in April over extradition to India, served as major blows to the 64-year-old businessman. Mallya has been in the UK since March 2016 and is currently out on bail on an extradition warrant issued by Scotland Yard on April 18, 2017.
And now let us take a look at the weather forecast for today. The national capital Delhi is likely to experience thunderstorm with rain. The minimum temperature will be around 28 degrees Celsius, while the maximum is likely to settle at around 40 degrees. Mumbai is expecting generally cloudy sky with 1 or 2 spells of rain or thunder showers. The minimum temperature will be around 26 degrees Celsius, while the maximum will be around 33 degrees. Chennai will have generally cloudy sky with light rain, minimum temperature around 28 degrees, while the maximum is expected around 35 degrees. Kolkata will witness generally cloudy sky with 1 or 2 spells of rain or thunder showers. Minimum temperature will be 26, maximum around 32. Chandigarh is likely to have generally cloudy sky. Temperatures 28 degrees Celsius minimum, while the maximum is expected around 37 degrees. Dehradun minimum temperature is expected around 24 degrees, while the maximum around 35 degrees Celsius.
In Hyderabad, the temperature will be between 23 and 31 degrees Celsius, whereas in Bangalore, the temperature will remain between 21 and 29 degrees Celsius. Ahmedabad will witness generally cloudy skies with moderate rain. The temperature will hover between 24 and 34 degrees Celsius. Bhopal will witness partly cloudy sky towards afternoon or evening, when the temperature will be between 25 and 38 degrees Celsius. In the eastern part, Patna is likely to have partly cloudy skies. The temperature will remain between 27 and 37 degrees Celsius. Guwahati is likely to have generally cloudy skies with 1 or 2 spells of thunder showers. The temperature will be hovering between 25 and 33 degrees Celsius. On to the north, in the Union Territory of Jammu and Kashmir, the minimum temperature will be 25 degrees Celsius in Jammu, while the maximum will be 37 degrees Celsius. And now, an overview of today's newspapers. Most newspapers today lead with Prime Minister Narendra Modi's address to the Indian Chamber of Commerce over video conference. Hindustan Times says, "People, Planet, Profit" is PM's mantra to industry, while the Asian Age, quoting the PM, says, "Turn COVID crisis into opportunity." The Hindustan Times gives a list of the best in educating: IIT Madras, best institution; IISc, best university. Reiterating that there has been one silver lining through the dark clouds of the pandemic is being resurgence and healing of nature. The Pioneer informs that the numbers of the majestic Asiatic lion are up to by 29% in Gujarat's Gir forest.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi calls for converting COVID-19 crisis into an opportunity to make India self-reliant. Recovery rate of COVID-19 patients improves to 49.21%. Railways fully geared to provide modified coaches for use as COVID care centres. Third phase of Vande Bharat mission to have 432 international flights from 43 countries. Punjab government orders lockdown on weekends and public holidays, and India asks UK not to consider fugitive businessman Vijay Mallya's request for asylum. And with that, we end the morning news. Have a nice day.